Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate how to change an ostomy pouching system. In the previous video I did an NCLEX review over colostomies and ileostomy, so be sure to check out that video. So first, let's talk about the supplies you will need. You will need a pouching system. Here I have a one-piece pouching system, and it has a skin barrier, also called a wafer, flange, and it's attached to the pouch, so it comes together. Some people have the two-piece systems, and the skin barrier and the pouch are separate and they snap onto each other whenever you're placing the system. Also, what you may need that I don't have right here, you may need a barrier ring, and the barrier ring will go around the stoma for extra protection in case the patient's having a lot of skin breakdown from stool getting onto the skin and the skin barrier just isn't really protecting it. So the barrier ring would go around the stoma, and then you would set the skin barrier on top of that. And then also with this particular system, we have a clip, so be sure you get the clip if your patient needs one. Some bags will Velcro, and that's how they close, but this particular one uses a clip. Another thing you will need is a measuring card, and these come in the kits usually, and you will just be using it to measure the stoma because you will be cutting around your barrier what size the stoma is so you can apply it to the skin. So you'll need a pin. You will also need some ostomy scissors. These scissors are special in that they're curved and they have a blunt tip, so you can achieve a circular cut instead of a jagged cut onto the barrier. And of course you will need gloves. You will need some washcloths to clean the stoma and to dry it, and a towel just to prevent any leakage of stool onto the patient. First, perform hand hygiene, and then you will don gloves. Then get a towel and place that on your patient to protect their gown and their skin from any stool while you're changing the system. And some things you want to keep in mind while doing this: you'll want to change this system about every 3 to 5 days, and you will empty the pouch whenever it becomes 1/3 to halfway full. And here, as you can see, this definitely needs to be emptied, but we're changing the system, so it's good. And while you're doing this, you want to allow the patient to help you as much as possible because they need to become independent in doing this because they'll be doing it whenever they go home. Now, if you are a nurse who has a very sensitive nose and you're bothered by odorous smells, you need to be prepared for this because whenever you're changing an ostomy bag, there are some pungent odors. And to help with this, you can maybe wear a mask. I've even known some colleagues to put vapor rub around their nose before they go in to change the pouch to prevent the smell, and so you can have a menthol smell in your nose as you're changing it. So just be aware of that and prepare beforehand. So what we're going to do is we are going to remove the system, and whenever you do this, you want to do this when the gut is the least active because you don't want to be changing this and all this stool is just coming out on you because you're going to be making a huge mess. So usually in the morning before breakfast, before the patient eats, is the best time, or ask the patient because they'll know when their stoma puts out the least. But if this is a brand new stoma, they may not know. So what you're going to do is you're just gently going to remove the adhesive because this is the one-piece system and it has it's sticking to the skin. And if you have difficulty removing it, you can use some adhesive remover. Okay, so we have that off. And what you're going to do is just discard this appropriately. Then you're going to take your washcloth with warm water. Try not to use any soaps that have lotions, powders, creams, or any alcohol-containing products around the stoma or on the stoma because it causes some problems. And before you do it, you want to make sure you're looking around the stoma and looking for any skin breakdown like extreme redness. Now, as you can see in this example, there is redness around the stoma. This is not good. And what is happening is that stool is leaking probably under that skin barrier and getting onto the skin. So whenever you're replacing the pouching system, you may want to use a barrier ring and make sure that you're cutting the skin barrier to fit the stoma appropriately so it's not leaking onto the skin. And what you'll do is you'll start around the skin and just gently clean the skin, making sure to get any residue off. And then you will clean your stoma. And the stoma is not painful to the patient. Remember, it's just the inside of the intestines flipped inside out. So it's not painful for you to clean the stoma. And make sure you have it all clean. Then you will pat the area dry. You want this to be very dry because if it's not dry, your skin barrier is not going to stick to the skin. And if you have a patient who has a lot of hair on the abdomen, because you know hair grows back, you may want to trim the hair because number one, it'll stick better, and when you remove next pouch change, it's not going to wax their hair off, which can be very painful. So make sure you do that. Then discard your gloves and perform hand hygiene and put on a new pair of gloves. Now we're going to measure our stoma using our measuring card. And the reason we want to do this is because we're going to be cutting a hole on our skin barrier. And this is going to be going on the skin, and we don't want to cut it too big where stool will leak onto the skin, or cut it too small where it will constrict the stoma. So we want to measure appropriately. And you'll take your measuring card and you'll put it flush up against the skin, and you want about a 1/8 inch area around the stoma. So this right here, way too big. That is too big as well. Let's try this one. And that one looks like it's perfect. You have around the stoma about a 1/8 inch. And look and see what it reads, and it says 45 millimeters. So we're going to match that up on our bag and trace it. Now, some skin barriers are already labeled and they have a nice little outline of where your measurement is. Like here, it already says 45 millimeters, so I don't have to trace it. But sometimes skin barriers don't have that. So what you would have to do is put your measuring card over it and trace where you had your measurement. So you would find the 45 millimeter and you would just create a circle on the barrier and then cut it out. Now I'm going to take my ostomy scissors and I'm going to cut around the 45 millimeter mark. And just go back through and make sure everything's nice and round and there's no jagged edges, because you don't want this to wear on the stoma or on the patient's skin. And we have it and it looks good. Now let's put the new pouching system on. What I like to do is I like to snap my bag and make sure it's closed before I put it on, just in case something leaks out. So this is the clip. Like I said at the beginning, some Velcro. These clips can be a little bit cumbersome to use, so get familiar with how to use them. What you do is you take the end of it, the bag, and you just simply fold it over the clip like so. And then you just press that down and it snaps in place. And you have your little clip on. And then you will take the backing off of your skin barrier. And if you're going to place a barrier ring, now would be the time to do that. So you place the barrier ring on around the stoma, and then you would place your skin barrier, your wafer flange, on over the stoma. And you want to make sure that it fits really good and that you smooth it around the stoma so it's sticking to the skin appropriately. And feels very good. Now, some things you want to keep in mind. If this is a new ostomy for the patient, you want to explain to them that they need to be checking their bag ever so often because it can inflate with gas, and they will need to do what's called burping their bag. And to burp this particular bag, you would take off this clip and just let the air out. Now, some ostomy bags do have a filter that allows the gas to escape and prevents an odorous smell from coming out. So you just have to look to see what you have, and just warn the patient that when they do relieve the gas from their bag, that they may want to make sure that no one's around if someone's visiting them or something like that, because it can produce an odorous smell. And as the nurse, you want to be checking this as well, because our patients tend to wear those big bulky gowns, and they can occlude you being able to see if the bag's inflated. So you'll have to pull the gown back and actually look at the bag. So that is how you change an ostomy pouching system. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.